Bismillahirrahmanirrahim. Hello everybody. A 17-year-old girl, gravida 1 para 0 at 37 week of gestation, come to the emergency department with headache, blurry vision and fatigue. The patient has missed her last few prenatal visits due to final exam in school. Blood pressure is 190 by 96 mm of Hg and pulse is 106 per minute. Urine lysis show 4 plus protein. Physical examination show increased ankle clonus but no neurologic deficit. Laboratory result include the following: hemoglobin 8.2 milligram per deciliter, platelets 56,000, aspartate aminotransferase 12, lactate dehydrogenase 1648. The patient is admitted to the maternity ward for induction of labor and deliver a boy the following day. Which of the following complication is most likely present in the neonate? Hypoxic brain injury, intraventricular hemorrhage, connectors, respiratory distress syndrome, small for gestational age, thrombocytopenia. So first of all, this patient came to us at 37 week of gestation. 37-week gestation with the headache, blurry vision, and fatigue. Second, she having hypertension. BP is 190 by 96 mm of Hg. Third, she having 4 plus protein on urine lysis. Fourth, on physical examination, she having ankle clonus. And laboratory analysis reveal anemia with increase lactate dehydrogenase. Lactate dehydrogenase level. So based on these forehand, what is the diagnosis of this question? The diagnosis of this question is preeclampsia with severe feature. Preeclampsia with severe feature. As we already know here that this patient is also suffering from anemia, because the most common cause of preeclampsia is the more common risk factor for preeclampsia is anemia. This patient is suffering from macroangiopathic hemolytic anemia, because her hemoglobin count is 8.2 gram per deciliter. So here the correct option is choice E, small for gestational age. Why the choice E? Because this patient new onset severe hypertension at 37 week of gestation, headache with visual symptom, increased ankle clonus and thrombocytopenia are strongly suggestive of preeclampsia with severe feature. Her elevated lactate dehydrogenase and anemia are consistent with microangiopathic hemolysis, a known feature of preeclampsia. Preeclampsia puts the fetus at risk for chronic uteroplacental insufficiency, which can lead to fetal growth restriction, low birth weight. Come to the incorrect one. Why the choice A is incorrect? Because hypoxic brain injury typically is due to acute uteroplacental insufficiency, that is from labor stress or abruptio placenta, which abruptio placenta typically present with vaginal bleeding and a tender distended uterus, neither of which is present in this patient. Choice B, intraventricular hemorrhage. So this patient is at 37 week of gestation, making the intraventricular hemorrhage unlikely. Choice C, connectors. Connectors, the neurologic sequelae of neonatal hyperbilirubinemia, is caused most commonly by neonatal hemolysis. Preeclampsia does not cause neonatal hemolysis. Choice D, respiratory distress syndrome. So prematurity increase the risk for fetal respiratory distress. This patient is at 37 week of gestation, making this complication unlikely. Choice F, thrombocytopenia. Preeclampsia does not cause fetal thrombocytopenia even with maternal thrombocytopenia. Come again to the choice E. Why the choice E is the correct and small for gestation is. So as we already know here that this patient came to us at 37 week of gestation with preeclampsia with severe feature, because she having headache, blurry vision and fatigue. Her BP is 190 by 96 mm of Hg and she having proteinuria. She also having ankle clonus, where there she having anemia and thrombocytopenia. So the diagnosis of this question is pre-eclampsia with severe feature, and the baby will be small for gestational age due to uteroplacental insufficiency. Thank you.